My name is Anita Jensen. I work as an associate professor at Norsk University and arts and health strategist in primary healthcare, as well as a researcher at Lund University. And in this short presentation, I'm going to talk about arts and prescription for health and well-being. Arts and prescription is a form of social prescribing. And the most common referral route is through the GP, but we also see job centers, social workers, link workers, and other community connectors referring participants. It's usually for individuals experiencing mental health problems, mostly anxiety, stress, and depression, and also social isolation. Most activities are group-based and are delivered alongside other treatments, and a variety of different programs exists. In order to better understand the evidence for this area, we have conducted a systematic review, and here we included 25 studies from 5 different countries, from the UK, from the USA, from Australia, Denmark, and Sweden. We included 10 qualitative, 8 quantitative, and 7 mixed method studies. We saw that programs were held in community settings, art venues, GP surgeries, primary healthcare settings, and 1 study was held in a school. It was mainly an adult population, although 1 study was with adolescents between 13 and 16 years of age. 7 of the included studies had the same measuring tools, which enabled us to conduct a meta-analysis, which showed an overall significant increase in well-being. Across the studies, we saw qualitative outcomes in terms of psychological benefits, social benefits, and also progression opportunities. When it's about psychological benefits, we saw self-confidence, improved self-esteem, a sense of achievement, engagement and pleasure, absorption, and forgetting of worries and concerns. We also saw social connectiveness, improved social skills and interaction, development of meaningful relationships with others, increased social confidence, sharing experiences, and normalizing emotions. In terms of progression opportunities, we saw participants reporting abilities to determine a new future, expanding worlds, accessing new worlds, assuming and sustaining new identities, health promoting changes and positive changes in life, joining new activities, and a shift to gain a sense of direction. Based on the review, we also saw some barriers which has implication for practice, and they include physical aspects such as transportation, language, mobility, and some participants being too ill. Psychological, it's about engaging, preferring medical solution. Some consider art as being elitist. In terms of social barriers, we saw that group dynamic and stigmas around mental health initiatives could be a barrier. And also systemic barriers such as awareness amongst the healthcare professionals and support at the end of the program and funding for the arts activities. So recommendations for future research, we recommend specific measurements for anxiety, depression, and loneliness. We also recommend looking at how arts programs are designed to match participants' needs and preferences. And we also recommend longitudinal research and research with companies. We have also conducted other studies within the arts and prescription area. For example, 1 study explores the perspectives of the cultural institutions that are involved. And here we saw that the cultural institution had positive attitudes about collaborations with the health sector. They found that they developed new professional skills, and they felt motivated to collaborate with new stakeholders. We also looked at healthcare practitioners' perception on the impacts of arts and prescription for their patients. And here we saw that they recognized that there's a need for more holistic approaches to treat people with mental health problems. They saw benefits in their patients in terms of motivation, routines, social interaction, and increased self-esteem. And they also saw that arts and prescription has the potential to positively impact on primary healthcare and society at large. They also saw or recognized that time pressure and the dominance of the medical model could be a barrier. And finally, using a critical lens on arts and prescription, in another study, we found that arts and prescription models required considerations at different stages. For example, how are the referrals made? How do we manage the different groups? What are the opportunities for moving on? And are there any care pathways afterwards? And also the development of guidelines for arts and prescription we saw as a priority. Now, we have also conducted a study on arts and prescription in primary healthcare in Sweden, and we used two measuring tools for well-being, and both of those outcomes showed a significance in changes in well-being. In terms of the qualitative outcomes, we saw that, which are very much in line with the systematic review findings, where we saw it was about social community, belonging, making new friends, finding common grounds, feeling less isolated and lonely, making connections. We also saw that self-efficacy was something that was achieved in the program. Participants gaining new interest, finding a voice, feeling human again, learning to cope with challenges, being able to relate to themselves and others and the community at large, and being curious and motivated. We saw them creating new routines and structures, looking forward, having something to look forward to, getting out of the house, new habits, and so on. We also saw a creative engagement where participants had new learning experiences, meaningful arts activities. They saw it as an eye-opener. They had fun and they played, and some experienced flow. So in summary, arts and prescription has the potential to improve well-being and reduce social isolation through non-clinical pathways. Some of the multiple mechanisms that might explain the impact on psychosocial well-being could be the social cure, which is about social connections, social and community connectedness. Participant activation, about routines, about structure. Sociological, it's about having flow, relaxation, feeling autonomous, expression, sharing, reflecting, and having a voice. There are also some critical problems with practice and delivery, including creating safe spaces for participants, sustainability of the arts activities delivered, and continuing care pathways. But all in all, there's a potential to scale up and apply pathways across cities, regions, and for different patient groups, and just being aware that some of the barriers, and also not one fits all. Thank you very much for your attention.